There seems to be serious questions now about the procedures and protocols in place at Texas Health Presbyterian.
That's right, John. This is a black eye not just against Texas Health Presbyterian, but also against the public health system in this country, because these workers were supposed to be protected. Months ago, hospitals were told to make sure that they could take care of Ebola patients. And I think what public health officials are starting to realize is that it may just be unrealistic to think that every hospital in this country knows how to handle this level of an infectious agent. Hospitals, in general have struggled with safety issues. I mean, thousands upon thousands of people die from hospital-acquired infections every year. And so I think that, many experts I've been talking to said the CDC was just was naive in thinking that any hospital could handle these. And I think this will renew calls that we ought to be designating specific hospitals like Emory, like the University of Nebraska, to be handling these patients, not just for the sake of the patients, but for the sake of the workers.
So, Elizabeth, the question is, on Sunday we learned there was one healthcare worker. This morning, now Wednesday, we learned there is two. What are the chances that there could be even more? We know that several other workers came in contact with Thomas Eric Duncan. There seems to be serious question now about the procedures that were in place. So what are the fears that more people could have been infected?
Right. Tom Frieden was very frank about this in press conferences this week. He said, there very well may be more. So I think that there really is a pretty good chance that we're going to be seeing more of these. If the protective gear somehow didn't work, or the process didn't work for two of these workers, you have to think that there very well could be more. And, they are right now at the sort of that worrisome window between the time that they would have been infected and the time that symptoms would appear. So we would be seeing this pretty quickly in the coming days.
So how does the CDC say it will prevent this in the future? We heard Thomas Frieden yesterday saying they'll have sort of a CDC SWAT team that will go to places like Texas, Health Presbyterian, should there be cases that develop.
Right, and I think that the thinking there is, if we can just send this SWAT team in, we can get this hospital in order, and we can get them to change their ways and do a better job at protecting their workers. But I think there may be a newer level of thinking, which is, wait a second, if these teams haven't been drilling, if a hospital perhaps doesn't have such a great safety track record, can you really just send a SWAT team in and fix it? And I think that's going to be discussed at the highest levels at the Centers for Disease Control. Is it possible to just sort of parachute in and fix things? Because I'll tell you, safety measures are tough to do, and they're a pain in the neck to do. They're not easy. It's a lot easier not to do them. And hospitals in general have been accused, or many of them have been accused, of just not being tough enough, not being rigorous enough. So I think questions will arise. Can you just parachute in and fix hospitals, or do you want to just designate certain hospitals that have a great track record?